Hi guys, this is Dr. Habing. This presentation is going to be a pretty short introduction on abdominal ultrasound in our small animal patients. We are going to just cover the basic large organs, how to find them, and how to recognize them. So the large structures that we are going to cover in the abdomen will be the liver, the spleen, the kidneys, the intestines, and the urinary bladder. We're going to talk about kind of briefly how to find them, how to recognize them, and I will try to mention how to make diagnostic images of them. That part should be a review for you. So using your knobs, changing your depth, your frequency, your gain, all of those things we've already covered, but I will try to point out some key things as we go. Okay, so again, quick review of how to make these diagnostic images. Once you find your organ, you need to make sure that you're using the correct frequency. So remember, frequency needs to be as high as possible, keeping in mind how deep you need to be imaging. So higher frequency is going to give you better resolution, but you're going to have less penetration. So if you have something more superficial, you can use a higher frequency and have a nicer looking image. If you need to image deeper, you're going to have to decrease your frequency. So give up a little resolution to obtain the depth that you need. So again, remember, keep in mind the frequency that you're using, your gain or your total gain compensation, so TGC, that is going to control the brightness of your image. So your overall gain is going to make everything brighter or darker. This is a little bit of a personal preference, but you want it sort of middle of the road like this image is showing here. And then your TGC sliders should be arranged so that the image is kind of homogeneously bright or dark. So you don't want any bright streaks across the images. And then depth, so the organ of interest should fill most of your screen. In this image here, we are looking at the kidney, the left kidney. You can see that there's not a lot of empty space deep to the kidney. The kidney is filling most of the screen. You need to remember where your freeze button is. So once you have the organ that you want to take images of and you have your depth set, you have your frequency where you want it and your gain, you're going to press the freeze button, you're going to annotate it and save it. Do also keep in mind your planes, so transverse plane versus sagittal planes. Again, this has been covered in previous sections. And in some organs like the kidney especially, and the intestines, you're going to want to take images in both transverse and sagittal planes. For the liver and the spleen, you want to image them in both planes. You're not going to be asked to take images specifically of transverse and sagittal planes just because the organs are a little different shaped, so it's a little harder to recognize for people just starting out. Okay, so we're going to start with the liver. So the liver is going to be the most cranially positioned intra-abdominal organ in the dog and the cat. Remember, it's immediately caudal to the diaphragm. So starting with your probe, just caudal to the xiphoid is going to be the best place to start. And I have two images up here on the screen of imaging the liver in both a sagittal and transverse plane. So remember, when we talk about these planes, we can talk about it in regards to how your probe is being handled, and we can also talk about it in regards to the organ itself. In this example, the sagittal plane is referring to how our probe is oriented. So in this image on the left, we have the probe with our little notch is going to be pointing towards the head. So this would be a notch here, and you're going to fan to the left and the right. And this is kind of showing you the kind of image slices that you're going to be taking. So imagine your ultrasound probe kind of like a flashlight. Okay, we're in a transverse plane. We're going to point it over to the right of the dog or the cat and then to the left of the dog or the cat. And then in a transverse plane, you're going to rotate your probe to where your nubbin, your little notch, is going to be pointing towards the right of the animal. If the animal is on their back, this is the right and this is the left. And then you're going to point your flashlight or your probe cranially towards the head until you see all of the liver disappear at the diaphragm, and then caudally where you're actually going to hit the stomach. Okay, and this procedure is going to be done with all of the organs. So again, we are going to try to image all of these major organs in both planes, fan through them in both planes, freeze, take images, annotate as needed. So here's some example images of the liver. So I want you guys to notice the echogenicity of the liver. It's completely homogeneous. There's no focal lesions. This is the gallbladder here. This is a transverse view of the liver. So this T is corresponding to the notch in our probe. So this is the right of the patient, the left of the patient, and this hyperechoic interface down here is the diaphragm. Okay, so here's a nice transverse view, kind of mid-liver. Again, the right side has the gallbladder. And on the left, if we had any more field of view over here, you would hit the stomach. This image here is a sagittal view. Okay, so this is going to be cranial and caudal back here. Here's the diaphragm. Here is a little bit of the stomach peeking out, and all of this is hepatic parenchyma. So it's kind of has a coarse echotexture, so notice that, and that is caused by these hyperechoic little lines that are actually portal vein walls, and that's what causes the parenchyma to look a little bit coarse compared to the spleen, which I'll show you in a minute. This is a sagittal view of the right liver, so here's your diaphragm. I know it's the right liver because I have the gallbladder, and then again, all of this is hepatic parenchyma. It's kind of a little bit hypoechoic and coarse looking. That's very normal. Okay, so again, recognizing normal liver. One, where it's located. It's going to be the most cranial organ in the abdomen. If you are looking for the liver and you keep hitting intestines and stomach, it means you're too far caudal. So go all the way up to the xiphoid. And if you have to, depending on the shape of the animal, you might need to point your probe up under the ribs, depending on the shape of the animal and the size of the liver. So again, the normal liver here is going to have this coarse echotexture compared to the spleen, and it's caused by these portal vein walls. This is the caudal vena cava coursing through it and crossing the diaphragm with hepatic veins. So hepatic veins do not have those nice thick walls compared to these portal veins. And then again, you've got the gallbladder here. The other way to compare this parenchyma as far as finding out if it's normal or not is comparing it to the falciform fat. The hepatic parenchyma should be pretty similar to the falciform fat or darker or hypoechoic. This comparison works best with cats because they tend to have a little bit more of a falciform fat pad, but it is something that you can use to decide whether or not the hepatic parenchyma is normal. Again, recognizing normal liver. It's hypoechoic usually compared to the spleen. It's coarse compared to the spleen, and it's going to be the most cranial organ that you are going to find. Okay, we're going to move on to the spleen. So we covered liver, so we were up here and we just looked at liver. So imagine with this radiograph, if you put your probe, right caudal to the xiphoid process, which is actually going to be way up here, but if you think about this as your costal arch, you're going to have to point cranially to get to the liver in this dog. The next organ that I usually image is the spleen, and starting with the splenic head makes the most sense because it's the part of the spleen that is going to be pretty much static in its location. It's going to be tethered here in this left cranial abdomen by these gastrosplenic ligaments and short gastric vessels. So the splenic head should always be in this left cranial abdomen, and it will look like this. So remember what the liver looked like in the last couple slides. This is more hyperechoic and it's more finely textured because you don't have those prominent portal vein walls. This is a sagittal view of the head of the spleen. So this is cranial, this is caudal, and it looks like in a dog, it's kind of got this triangular shape. For cats, the cat spleen is not as big as the dog spleen, and usually you can find the entire spleen up in this left cranial quadrant. So for dogs, you're going to find the head, and then you're going to have to sort of trace the rest of the body and tail to see how it's laying in the dog's peritoneum, because sometimes it can cross midline here, sometimes it can extend along the left, lateral abdominal body wall. With cats, most of the spleen is usually located about here. Okay, so starting the spleen, start in the left cranial abdomen, should be a little bit caudal to that left liver, and you will also run into a little bit of left kidney here as far as landmarks. Here's some sample images. So this is the splenic kind of body and head more in a transverse view in a dog. So if you rotate your probe, so this is going to be right and left, the spleen often looks kind of C-shaped, again, in the dog. In the cat, you may not get similar images, again, just because the cat spleens are smaller. Here is a nice view of the body of the spleen, and then same thing here. So we have the hilus, so you have some splenic vessels coming in here at the hilum. You can see here we have the spleen taking up most of our image. You don't have a lot of unused space deep to it. We've got the gain set where it's pretty nice and homogeneous all the way through, so our time gain compensation scale is appropriate. The image isn't too bright, it isn't too dark, again, and our depth is appropriate. So these are things you need to think about for all of your image acquisitions. Again, normal spleen is going to be brighter than the liver. So this is liver here on the left. This is spleen here on the right. The spleen is brighter. It's hyperechoic compared to the liver, and it's finer textured. It kind of looks more like, like sugar. So it's sort of grainy, but it's finely textured compared to this liver that is a little bit coarser because of these portal markings. All right, our next big organ is going to be the kidneys. Kidneys are a lot easier to recognize because they look like kidneys, right? So they're bean-shaped or a little bit rounded. Dog kidneys tend to be a little bit more elongated than cat kidneys, but both dogs and cats should have this same structure where you have an outer cortex that's a little bit brighter than the medulla, which is darker and more centrally located, with these, several hypoechoic kind of pyramids of the medulla. These brighter areas in the central part of the kidney, some of them are vessel walls like this. Some of them are the lining of the pelvis and the diverticulae. So this is all very normal. Finding the left kidney should be pretty simple, and it's usually located caudal to the splenic head. So if you are already in the left cranial abdomen, just slide your probe a little bit caudally, and you should hit the kidney. If you are running into intestines and other things like that, you're probably to midline. So remember, those kidneys are pretty dorsal. If you think about, what they look like on a radiograph, on a lateral radiograph, they're pretty dorsal. So if you keep hitting intestines, you may not be dorsal enough, you may not be lateral enough. The right kidney is a little bit harder to find, especially in dogs, because sometimes it can be tucked up under the rib cage. But I find it the easiest by following the costal arch over to the right. And then again, remembering it's dorsal in the retroperitoneal space. Don't point towards midline. Remember, your probe is kind of like a flashlight, so you might be placing it over in the right area, but if you're pointing across the abdomen, you're not going to see kidney, you're going to see intestines. So remember where it's located, and if you have to stop and actually look at where you're pointing on the animal, that can be quite helpful. Finding it caudal to the liver is another thing you can try. So if you're still not finding the right kidney, find the right liver. So remember that it is nestled up there in the caudate, along the caudate lobe of the liver. It's in this little renal notch, and you should find the right kidney that way. Cat kidneys are a little bit easier to find because they're a little bit more, they're less tucked up, they're a little bit more mobile. With that said, sometimes you can push them away. If you're putting too much pressure, you might actually be pushing the kidneys away and not finding them in the cat because you're just displacing them. So be careful with that when you're imaging feline patients. Okay, some examples of normal kidneys. First, before we start talking about what they look like normally, let's look at these images and our image acquisition parameters. So all of these kidneys are taking up most of the field of view, which is good. So you want to decrease your depth to make your kidney fill most of the screen, making sure your gain is appropriate, making sure your frequency is appropriate. So we want, again, high frequency to get nice resolution, but we want to be able to penetrate as deep as we need to based on where this kidney is located. In all of these examples, you can see the kidney is nice and bean-shaped or kind of more rounded in the cat. This is a cat kidney here on the left where it's a little more rounded compared to a dog, which is a little more elongated. You can see the cortex. You can see the medulla is here more centrally. This is the medulla in the cat. It's nice and hypoechoic. And then these hyperechoic structures here are lining the pelvis. So this is actually an edge of the renal pelvis. And then up here, these are actually renal vessels or margins of the diverticulae. So that's all pretty normal. The echogenicity, again, the cortex here is going to be brighter than the medulla. And then we can also compare the renal cortex to the spleen. So especially on the left, because the spleen is located right there. It should be pretty similar. It should not be brighter than the spleen. Okay, but just remember, recognizing the kidney is pretty easy. Finding them, it should be pretty simple. For kidneys especially, you want to try to take both transverse and sagittal images. So in a sagittal plane, the kidney is going to be as elongated as possible. And then when you turn your probe in a transverse plane, you're going to get this cross section, shorter plane of the kidney showing the renal pelvis centrally. Okay, we're going to move on to the gastrointestinal tract. So the GI tract is a little bit more complicated just because it has a lot more movement within the abdomen. It's not a nice discrete organ like our kidneys, but in general, ultrasonographically, we're going to look at these specific structures. So the stomach, which is going to be immediately caudal to the liver, most cranial part of the GI tract. The duodenum is going to be in the right lateral abdomen here. And the jejunum is going to be pretty spread out throughout the peritoneum. The ileocolic junction is going to be in the right lateral abdomen, adjacent to the duodenum, and then the colon is easiest to find by starting at the pelvic inlet and imaging cranially. For the purposes of this talk and for your guys' kind of lab in OSCE, we're really just going to be talking about intestines and how to recognize them. Because the walls and the layering is going to be similar throughout all of the GI tract. So as long as you can recognize that, it's a great starting point for figuring out what part of the GI tract you're looking at. So we're going to focus pretty general right now for the GI tract. Okay, so here's some examples of intestinal ultrasounds. And your images may not look like this because this is using a pretty high frequency linear probe. Okay, so our depth is really shallow. We're only at 2.5 centimeters here. But I wanted to show you what intestinal walls will look like. And this is the same layering pattern that the stomach also has and the colon. This is a segment of jejunum, and we're imaging it in longitudinal. So here's the lumen, and it's hyperechoic because it has a little bit of gas and fluid in it. So gas will make a hyperechoic interface. And there's probably a little bit of fluid mixed in it as well. Same here with the colon. So this is the colon, and from here to here is lumen, okay? And that is gas mixed with fluid. That's why it has these hyperechoic speckles, but it also has some hypoechogenicity to it as well, which is kind of fluidy fecal content. This is the more superficial wall from the caliper marker here to here. And in the colon, you may not get nice distinct layering like you will see in the small intestine. It's just because the wall is a lot thinner and it's a little bit harder to resolve those layers, but they are there. Okay, so this is another sagittal view of the colon. So here's the kind of ventral wall, here's the lumen, and then the dorsal wall is here. And in this image, we have a sagittal view of the jejunum. So the wall is thicker, same layering pattern though, alternating from hypo to hyper to hypo. And then the lumen, another wall here. And then these are just segments of jejunum in transverse. Okay, so if I was to image this one cut through here in a transverse plane, it would look like this. They look like little hamburgers or macaroons. Again, centrally is going to be the lumen. And the lumen will look different depending on what is in the lumen, right? So in these situations, we've got a little bit of gas, a little bit of fluid. If it was purely fluid, it's going to be more hypoechoic within that lumen. So just keep that in mind, that they may not all look like this, just depending on how distended they are and what is in the lumen. Okay, again, that same wall pattern can be seen throughout the GI tract, including the stomach. So this is a cat stomach, and you can see these little kind of folds. These are rugal folds, and this is the fundus of the stomach. We're marking the wall here from here to here, so that is the entire wall thickness. The lumen is here kind of obscured by some gas. So this hyperechoic interface is gas within the lumen, causing some artifact that is kind of streaking deeper. This down here in the bottom right is the ileocolic junction. Again, we're not expecting you to recognize all these specifics, but I just want you to see the pattern, okay? So lumen can be really variable in appearance. It can have gas, it can have fluid, it can have a mixture of both, it can have feces if it's the colon. But you should see a wall superficial. You may not always see the deep wall depending on what's in the lumen. So this is the colon that is sort of in a kind of oblique plane, and this is an end on ileum. Okay, so this ileal wall is sort of folded on itself. That's why it's really hard to see where the lumen is. It's collapsed. Up here on the top right, we have small intestine, both in longitudinal plane and in a transverse plane. Okay, when I'm using these terminologies, transverse and long, I'm talking about the orientation of the organ. So your probe may be very oblique, it may be in a transverse or sagittal plane, but the images of the organ itself is in a longitudinal or sagittal plane. That means the same thing, or in a transverse plane here. So again, here's lumen. This is lumen here. Here is one wall, the more superficial wall, and here's the deep wall. Keep in mind our depth. So we're all trying to use our field of view as best as we can. We're pretty superficial in these scenarios. Our gain is appropriate. Our frequency is also good. All right, last but not least, let's talk about the urinary bladder. So the urinary bladder is found in the caudal abdomen, obviously. If you're having a hard time finding it in a live animal, go to the pubis. So you're going to put your probe way back here till you hit bone, and maybe go in a transverse plane. So if you're imaging in a transverse plane, you're actually, slicing the animal, from right to left. So you should not miss it. And then start to slide cranially, and you should hit the urinary bladder. So in the dog, the urinary bladder can be partially intrapelvic. The cat urinary bladder is usually all intra-abdominal. They have a little bit of a longer bladder neck, and it is going to vary in appearance depending on how distended it is. So this example here on the right is the urinary bladder, nice and normal. It's moderately distended. You can see it's containing pretty anechoic, maybe mildly echogenic urine, and the wall is nice and thin. Okay, so I don't have any thickening. I don't have any calculi in here. The trigone is going to be back here. The apex is here. So this is telling me my nubbin is pointing towards the head here and the tail here. I know this is a sagittal view of the bladder just because it's shaped, because it's kind of tapering down here towards the trigone. Some other examples of things you might see, and just want to make sure you can recognize the bladder. In this case, there's a lot of echogenicity within the urine. So if the urine is very echogenic, it might be a little harder to recognize the bladder. But remember, this is a dynamic imaging modality. So you can, put some pressure on here. You can ballot it, meaning, jiggle it around and see that this stuff moves and swirls around and is actually a fluid-filled structure. So in this case, this is the peritoneal surface right here, this little hyperechoic interface. So all of this from here to here is body wall. So musculature and sub-Q fat. All of this is peritoneal cavity. There's a little bit of vasculature that we're kind of imaging obliquely. And again, your bladder is here. The trigone is going to be towards this area, and this is the apex. Same orientation here on the right, where this is all body wall. This is an edge artifact here, this hypoechoic line. And then the bladder is kind of oval, tapering down to a point where the trigone is. So for the bladder, imaging it both sagittally and transversely is important. Fanning all the way through is important. So remember, we're just, like this image is just showing us a very thin slice of a bladder in a sagittal plane, right? So we need to, in real time, be fanning, in this case, fanning all the way to the right and the left. If I was in a transverse plane, I'd be fanning from cranial to caudal. Okay, so that's bladder, and that was all of your major intra-abdominal structures. So you guys should feel a little bit better about finding these organs on ultrasound and what they look like. Okay, so you should be able to find the liver, the spleen, recognize them both as separate structures. That might be the hardest part because the parenchyma is probably more similar than any of the other organs that we're talking about. But remember, the liver is going to be darker and coarser. And then remember where they're located. You should be able to locate both kidneys and take images both in transverse and sagittal planes. You should be able to locate the urinary bladder and take images both transverse and sagittal planes, and then recognize a segment of the GI tract. If you guys have any questions, please email me. I would be happy to help. Thank you.